Hello everyone. Myself Dr. Ramya, Assistant Professor, Department of Pharmacology. In this video, we are going to see about general management of poisoning. What do you mean by poisoning? Giving or taking poison or a dangerous substance. A poisoning case can present to a doctor or hospital in a number of ways. 4 types of presentation are seen. Number 1, fulminant, produced by massive dose. Number 2, acute, produced by a single dose or several small doses taken in a short period. Number 3, chronic, produced by small doses taken over a long period. Number 4, subacute, characterized by a mixture of features of acute and chronic poisoning. The general management of poisoning is subdivided into different categories. First one is stabilizations, followed by evaluation, decontamination, poison elimination, antidote administration, and nursing and psychiatric care. In this video, we will see in detail about stabilizations. Stabilizations. The initial survey should always be directed at the assessment and correction of life-threatening problems, if present. Attention must be paid to the airway, breathing, circulation, and depression of the CNS. The airway and breathing. Symptoms of airway obstruction include dyspnea, air hunger, and hoarseness. Signs comprise stridor, intercostal and substernal retractions, cyanosis, sweating, and tachypnea. Some substances which are known to cause respiratory depression are listed below in the table. Circulation. Several drugs produce changes in pulse rate and blood pressure is given in the below table. It may lead to condition like tachycardia, hypotension, hypertension, bradycardia, while others induce cardiac arrhythmias and heart block. Depression of central nervous system. A practical guide that can be easily applied and is quite reliable is mentioned in Table 3.5, which also has the additional advantage that it takes into account not only CNS depressants producing true coma, but also CNS stimulants which produce coma only in the last stage. In management of respiratory insufficiency, first establish an open airway. Remove dentures, if any. Use the chin lift and jaw thrust to clear the airway obstructed by the tongue falling back. Remove saliva, vomitus, blood, etc. from the oral cavity by suction or finger sweep method. Place the patient in a semi-prone, lateral position. If required, insert an endotracheal tube. If ventilation is not adequate, begin artificial respiration with ambu bag. And next step is oxygen therapy. This is done to raise the PaO2 to at least 45 to 55 mm of mercury, 6.0 kPa to 7.3 kPa. Begin with 28% oxygen mask. Circulatory failure is managed by following method. Correct acidemia, if present. Elevate foot end of the bed, Trendelenburg position. Obtain an ECG in hypotensive patients and note rate, rhythm, arrhythmias, and conduction delays. Vasopressors of choice include dopamine and norepinephrine. Next one is management of cardiac ARRHYTHMIAS. Obtain an ECG, institute continuous cardiac monitoring and administer oxygen. Evaluate for hypoxia, acidosis, and electrolyte disturbances, especially hypokalemia, hypocalcemia, and hypomagnesemia. Lignocaine and amiodarone are generally first-line agents for stable monomorphic ventricular tachycardia, particularly in patients with underlying impaired cardiac function. Unstable rhythms require cardioversion. Atropine may be used when severe bradycardia is present and PVCs are thought to represent an escape complex. At last, management of CNS depression. Till recently it was recommended that in every case where the identity of the poison was not known, the following 3 antidotes, called the coma cocktail, must be administered intravenously. Dextrose, 100 ml of 50% solution. Thiamine, vitamin B1, 100 mg. Naloxone, 2 mg.